Now I give the floor to the representative of medical impact.
Colleagues and Excellencies, as the Executive Director of Medical Impact, I am honored to address this critical high-level meeting on antimicrobial resistance. AMR is a multifaceted challenge that affects human health, animal health, agri-food systems, and our environment. To address this complex issue effectively, we urge Member States to adopt an integrated, people-centered approach towards converting commitment into action. Member States need robust surveillance systems to monitor AMR patterns and ensure timely responses, committing towards strengthening international cooperation and multilateralism, investing in advanced technologies and enhancing global data sharing are crucial steps. We must build capacity across health systems, particularly in underserved areas, to diagnose and treat infections accurately, ensuring that interventions are both effective and sustainable. In the realm of animal health and agri-food systems, we urge Member States to promote a responsible use of antimicrobials, implementing stringent regulations on their use in agriculture and encouraging alternatives such as improved animal husbandry practices will help to reduce the emergence and spread of resistant strains. Contamination from pharmaceutical waste and agricultural runoff contributes to AMR. Therefore, we need to strengthen environmental regulations and invest in innovative waste management solutions. We urge Member States to mobilize resources to support research and development of new antimicrobials, vaccines, and diagnostic tools. Collaboration between governments, private sectors, civil society organizations, and communities are vital to ensure sustainable funding and equitable access. Thank you.
I thank the representative of medical impact.